Welcome to Fertility East. My name is Dr. Joel Bernstein and I am the Medical Director of this fertility unit. I've dedicated more than 25 years to treating patients with fertility problems and am delighted that currently more than 85% of patients we see will be able to have children. The aim of this video is to answer some basic questions which will aid you on your path to fertility. Subsequent videos will deal in greater depth with additional fertility subjects. There are 6 questions that you need to answer. The questions are we fertile? When should we seek medical help? Who should we consult? What sort of tests are needed? What kind of treatment should we have? And what to do if all else fails? Question 1. Let us begin with the first question. Are we fertile? The only true test of your fertility is the birth of a baby, and there is no test that can actually answer this question. What we as fertility specialists do is test the 3 basic building blocks of all fertility, that is sperm, eggs, and the female reproductive pathway, comprising of the vagina, cervix, uterus and fallopian tubes. Provided these are normal, we assume normal fertility, and then with knowledge of fertility rates for couples in your specific age range, we will develop a plan of action so that time is not wasted and you can work towards an achievable goal. Normal fertility does depend upon female age, and so it is important to understand what you are capable of achieving. Age and female fertility. If we look at the next table, this table shows age range and percentage pregnancy for normal couples. So between the ages of 20 to 25, these are female ages, 84% of couples will fall pregnant in 1 year. Between the age of 26 and 30, 74% will achieve a pregnancy. 31 to 35, 69% will achieve a pregnancy, and 36 to 40, 59% will achieve a pregnancy. Over 40, the incidence of pregnancy rapidly reduces to 0, and this could occur in the next 2 to 3 years. Interestingly, normal human beings as a species are not as fertile as we thought, especially compared with the animal kingdom. To put age-related fertility in another way, for females aged 24 to 25 years, 3/4 of couples conceive in less than 6 months. For females of 36 years of age, however, only 1/4 of couples conceive in less than 6 months. The real take-home message is that couples should not delay having a child, as female age is a significant factor in reducing your normal chances of having a baby. Question 2. This leads us to our second question. When should we seek help? The answer to this question really lies in the definition of infertility. To put it another way, once you're defined as infertile, you need specialist help. The definitions of infertility are based on female age. For couples where the female is less than 35 years old, once you've tried for 12 months without any success, you're defined as infertile. For couples where the female age is 35 or greater, the time span is reduced to 6 months. If no pregnancy has occurred, you're deemed infertile. There are, of course, other factors to be considered. So download our brochure, Are You Planning to Have a Baby?, from our website www.fertilityeast.com.au. Question 3. Our next question is, whom should we consult? Today, the management of infertility really requires the expertise and care of a fertility specialist. In addition, infertility involves both members of the couple, and so couples, and not just the female partner alone, require to be investigated and treated. Question 4. What are the basic tests needed? Basic infertility testing covers the 3 major building blocks mentioned. That is, sperm, eggs, and the reproductive pathway. Sperm. This is tested by 1 or more semen analyses, which should be undertaken by laboratories with a special interest in fertility, and these are usually associated with fertility units. Eggs. Tests of eggs involve blood tests at specific times of your menstrual cycle and should answer 2 questions. Do I have eggs? Do I ovulate? And is the process normal? Reproductive pathway. Finally, non-invasive tests of the reproductive pathway include a special X-ray of the cavity of the uterus and tubes called a hysterosalpingogram or HSG, and a pelvic ultrasound. This chart summarizes the basic tests for male and female. What treatment do we require? Once these basic tests have been completed, and usually they can all be done within 1 menstrual cycle, most causes of a couple's infertility can be determined and a plan of treatment provided. A specific treatment plan should be developed with your involvement and understanding. This approach would mean that you commence on a specific type of treatment with a defined number of attempts. Should these attempts prove unsuccessful, you know at the outset what your next treatment option is, and so forth. This type of structured approach is both effective and, having a plan of action, helps to reduce stress. If all else fails, one should seek a second opinion and then can look to alternatives. For more details on any section of this video, log on to my website www.sydneyfertility.com.au and click onto my free electronic book on fertility, Yes, We Can Have a Baby. Finally, for those of you already having treatment, ask questions, make sure that you have a progressive treatment plan, and most important of all, don't give up too soon, as over 85% of couples will ultimately achieve their goal.